Hello, and welcome back to my channel Healthcare One. Today, we are going to talk about the 3 best foods that can help to stop stroke in its tracks. So if you have had a stroke, or you have had transient ischemic attack TIA, which is called the mini stroke, or if you are at risk for stroke because of your high blood pressure, diabetes, high cholesterol, smoking, or other risk factors, then this video is for you. Make sure you watch it till the end. And also don't forget to like and subscribe. And if you are new here, make sure to hit the bell icon so you get notified every time I post a new video. So let's get into it. Number 3 on the list is turmeric. Now, turmeric is a golden-colored spice that comes from turmeric plant.
Hi.
It has been used for more than 4,000 years in India for its medicinal properties. Turmeric contains a substance called curcumin, which has many health benefits, including lowering inflammation and acting as an antioxidant. In fact, studies show that people who eat more curcumin have lower risk of developing many chronic conditions, including heart disease, cancer, and Alzheimer's disease. But how does turmeric help to prevent stroke? Well, there are a few ways. First, it reduces inflammation throughout the body, including in the arteries. This can help to reduce the buildup of plaque, which can block the arteries and cause a stroke. Second, curcumin has been shown to improve the function of blood vessels, making them more flexible and less likely to develop clots. Third, turmeric also helps to reduce the risk of diabetes, which is another risk factor for stroke. There are several studies that support these claims. For example, one study found that people who consumed the most turmeric had a 28% lower risk of developing cancer. Another study found that consuming curcumin supplements reduced the risk of developing cardiovascular events like heart attack and stroke by 18%. However, it's important to note that most of these studies were conducted on people who consumed turmeric regularly as part of their diet. The amount of turmeric used in these studies was about 1 to 2 teaspoons per day. So how do you incorporate more turmeric into your diet? You can add turmeric powder to your food while cooking, or you can take turmeric capsules as a supplement. But remember, if you are taking turmeric as a supplement, it is important to follow the recommended dosage. Too much turmeric can cause side effects like nausea, vomiting, diarrhea, and abdominal pain. Also, turmeric can interact with certain medications, including blood thinners and diabetes medications. So be sure to talk to your doctor before taking any turmeric supplements. Number 2 on the list is fatty fish. Fatty fish, such as salmon, mackerel, trout, and sardines, are rich in omega-3 fatty acids. These healthy fats can help to reduce inflammation in the body, and they can also help to improve blood flow. In fact, one study found that eating 2 servings of fatty fish per week was associated with a 17% lower risk of stroke. So how do omega-3 fatty acids work to prevent stroke? First, they reduce inflammation. Inflammation is a natural process that occurs when your body is trying to heal itself. However, chronic inflammation can damage the body's tissues and organs. Omega-3 South can help to reduce this chronic inflammation. Second, omega-3 South can also help to improve blood flow by making the blood vessels more flexible. This can help to reduce the risk of plaque buildup and blood clots, both of which can cause a stroke. Third, omega-3 South can also help to improve the function of your heart and overall cardiovascular system. This can help to reduce your risk of developing heart disease, which is a major risk factor for stroke. If you want to increase your intake of omega-3 South, you can start by eating 2 servings of fatty fish each week. Each serving should be about 3 ounces or 85 grams. If you do not like fish or cannot eat it due to religious reasons or allergies, then you can get your omega-3 South from other sources such as flax seeds, chia seeds, walnuts, and soybeans. But it is important to note that plant-based sources of omega-3 South are not as easily absorbed by the body, so you need to consume more of these foods to get the same amount of omega-3 South. You can also take omega-3 supplements, but again, be sure to talk to your doctor before taking any supplements. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. Now, number 1 on the list is extra virgin olive oil. Extra virgin olive oil is a type of oil that is extracted from olives. It is often used in Mediterranean cuisine, and it has a distinctive fruity flavor and aroma. But olive oil is more than just tasty. It also has a number of health benefits. In fact, extra virgin olive oil has been associated with a reduced risk of heart disease. stroke, type 2 diabetes, and even some types of cancer. So what makes olive oil so healthy? Well, it is mostly due to the high concentration of monosaturated fats, particularly oleic acid. These healthy fats can help to reduce inflammation in the body, and they can also help to improve blood flow. In fact, one study found that people who consumed the most olive oil had a 21% lower risk of stroke. Extra virgin olive oil also contains a number of antioxidants and other beneficial compounds, including polyphenols, carotenoids, and vitamin E. These compounds contribute to the oil's anti-inflammatory and antioxidant properties. Polyphenols, for example, are thought to help protect against heart disease and cancer by reducing oxidative stress and inflammation. Carotenoids, on the other hand, are thought to help protect against age-related cognitive decline and eye diseases. So how do you incorporate extra virgin olive oil into your diet? You can use it instead of other types of oil when cooking, or you can simply drizzle it over salads or other dishes. You can also use it as a replacement for butter or margarine when baking or vegetables. And if you like, you can even drink it straight. Just take a small amount, about 1 tablespoon, and swallow it down with water. The American Heart Association recommends consuming up to 20 grams of olive oil per day. Let's keep in mind that too much olive oil can cause weight gain because it is high in calories. Now you may wonder, why is it important to stop a stroke in its tracks? Well, it's because the faster you can get treatment after a stroke, the better the chances are that you will make a full recovery. In fact, every minute that passes during a stroke, 1.9 million brain cells are damaged. That's why it's important to know the signs of stroke and to seek treatment right away. The most common sign of a stroke is sudden numbness or weakness in the face, arm or leg, especially on one side of the body. Other signs include trouble speaking or understanding speech, difficulty walking, dizziness, loss of balance and coordination, sudden severe headache with no obvious cause. If you experience any of these symptoms, even if they go away on their own, it's important to seek medical attention right away. Don't try to drive yourself to the hospital. Call 911 or ask someone else to drive you. Even if the symptoms are mild, it's important to rule out a stroke. Early treatment can help to prevent further brain damage and disability. In conclusion, stroke is a serious condition that can cause permanent damage to the brain and body. But there are things that you can do to help prevent stroke, such as eating a healthy diet, getting regular exercise, and not smoking. By following these tips, you can help to keep your arteries clear and your blood flowing smoothly. You can also help to reduce your risk of developing risk factors for stroke, such as diabetes and high blood pressure. Remember, even small changes can make a big difference. Thank you for watching today's video. Please like and share it with your friends and family. Till next time, stay healthy.